Thank you, Vice Admiral Adams and Mr. Engels, for being here and for your ongoing work. We look forward to the call to action on maternal health and continuing to partner with you in this important work. My name is Kristina Wint, and I am the Program Manager for Women's Health at the Association of Maternal and Child Health Programs, or AMCHIP. AMCHIP is a national resource, partner, and advocate for state public health leaders and others working to improve the health of women, children, youth, and families, including those with special healthcare needs. AMCHIP is proud to be a part of the Maternal Health Learning and Innovation Center. We have team members serving on the Maternal Health Learning and Innovation Center Policy and Innovation Cores, bringing our insight and connection into those areas to MHLIC customers. We are honored to be able to sponsor and introduce Loretta Roth. We recognize that reproductive justice is a necessary framework for achieving maternal health equity. Loretta is a founding mother and champion of reproductive justice, and we are so glad she could join us today. Loretta Ross is an expert on women's issues, racism, and human rights. Her work emphasizes the intersectionality of social justice issues and how this transforms social change. She is a nationally recognized women's rights and human rights leader. Ross is the co-author of Reproductive Justice, An Introduction, a first of its kind primer that provides a comprehensive yet succinct description of the field. Putting the lives and lived experience of women of color at the center of the book and using a human rights analysis, Reproductive Justice provides an essential guide to understanding and mobilizing around women's rights in a period in which women's reproductive lives are imperiled. Ross is also a co-author of Undivided Rights, Women of Color Organized for Reproductive Justice, and author of the Color of Choice chapter in Incite, Women of Color Against Violence. She has written extensively on the history of African American women and reproductive justice activism, and is a member of the Women's Media Center's Progressive Women's Voices. Ross appears regularly in major media outlets about the issues of our day. She was a founder and the national coordinator from 2005 to 2012 of Sister Song, Women of Reproductive Justice Collective, a network of women of color and allied organizations that organize women of color in the reproductive justice movement. Ross is a rape survivor, was forced to raise a child born of incest, and is a survivor of sterilization abuse. She is a model of how to survive and thrive, despite the traumas that disproportionately affect low-income women of color. She is a nationally recognized trainer on using the transformative power of reproductive justice to build a human rights movement that includes everyone. Ross serves as a consultant for Smith College, collecting oral histories of feminists of color for the Sophia Smith Collection, which also contains her personal archives. She is a graduate of Agnes Scott College and holds an honorary doctorate of civil law degree awarded in 2003 from Arcadia University, and a second honorary degree awarded from Smith College in 2013. She is pursuing a PhD in Women's Studies at Emory University in Atlanta. She is a mother, grandmother, and great-grandmother. Thank you so much, Loretta Ross, for all the work that you do. During the presentation, you can submit your questions to the Ask button on the lower left corner of your Symposium platform, and we'll do our best to get to your audience questions. But with that, Ms. Loretta Ross, thank you.
Oh, thank you for that fabulous introduction. It's always a bit embarrassing when people read your resume and you're almost 70 years old, because it sounds like you did nothing else in life but political work. But I have to say, I party as hard as I do the politics. I'm going to talk today about how maternal and child health is a reproductive justice issue. So I'm going to start by first defining what is reproductive justice and how it came about. And then I'm going to talk about the foundation of reproductive justice, its human rights framework that underlies reproductive justice. And then I'll turn to the questions and answers that I'm sure and hope will pop up in the chat room. Well, reproductive justice began in 1994, and I was lucky enough to be one of 12 African-American women who are attending a conference in Chicago by the Illinois Pro-Choice Alliance. And in 1994, Hillary Clinton was at the time trying to produce a congressional and presidential plan for healthcare reform, which was very necessary. We still don't have full healthcare coverage like we need it in this country. We actually need universal health care. But nonetheless, she was presenting this plan, and somehow the strategists attached to this plan thought if they omitted reproductive health care from health care reform, that they could lessen its opposition. And we, 12 Black women, saw this plan and said, oh no, this doesn't work. And we were from all different organizations, so we didn't have any uniform organization that we could speak through. I was one of the 12. And one of the things we objected to was that if you omit reproductive health care from healthcare reform, then you omit the main driver of women to the doctor. And so you end up with a very unbalanced male centric healthcare plan. And so we decided that we were going to place a full page ad in the Washington Post to try to get the legislators' attention. And we did so on August 16th, 1994. You can look up the records. Congresswoman Maxine Waters spoke and led our press conference on the issue. But because we were coming from all these different organizations and we wanted to center ourselves in the lens, one of the things we discussed was how too often abortion in particular and reproductive health care in general was always isolated from the social justice issues that people experience in their real lives. Quite often, people are choosing between going to the doctor and paying for rent, or going to work, or staying home with a sick child. These are the real issues that people deal with as they decide how to optimize their life choices. And so we spliced together the concept of reproductive rights and social justice to address this severance that we didn't think was working for us. And we coined the term reproductive justice. Then we went on to define, well, what does this mean? Because we have to have the elevator speech to talk to people once you have this broad conceptual merging take place. And it started out by saying, well, we don't reject the pro choice movement because we join with them, in fact, in fighting for the right of people not to have a child. So we fight for the right of people to use abortion or birth control or abstinence if you can hold on. I mean, that's an unproven theory in terms of my life, because I don't abstain from anything, but they say it works. But anyway, we've joined with the pro choice movement to fight for bodily autonomy and the right to control your own reproductive destiny. But because this theory was created by Black women who are most frequently subjected to strategies of population control, also known as eugenics, just like the cases here in Georgia that just got revealed that the incarcerated undocumented women, some of whom were Black, some of whom were Latina, were subjected to illegal and unnecessary hysterectomies and sterilizations that just broke last week. Well, we have to fight equally for the right. We have to fight equally hard for the right to have the children that we want to have. So that's the second tenet of reproductive justice. First, the right not to have the children, and then the right to have the children, and to have those children under the conditions of our choice. So that involves using doulas and midwives if you need to have hospitals if you're going to birth there, respect your birthing plan, not to be subjected to an unnecessary cesarean section just because someone thinks it's more convenient for them for you to give birth within a certain window, those kinds of things. And then to go further, we established the third tenet, which is the human right to raise your children in safe and healthy conditions and environments. And once we established that as our third cornerstone, then that brought us into conversation with a lot of other issues that people tend to see as disconnected from reproductive politics and maternal and child health. Because we wanted to talk about what's now called the social determinants of health, but we wanted to talk about adequate housing, food insecurity, gun violence, the school to prison pipeline, quality education, the environment, the political processes, taxes, how poor communities don't have fair treatment from tax assessors or home appraisals and everything that deals with human interaction. So, to summarize, reproductive justice has three tenets: the right to have a child, the right not to have a child, and the right to raise your children in safe and healthy environments. Now, having said that, we also realized that the US Constitution was inadequate for providing for these rights. They don't necessarily think of how the right to reproduce and the right to raise your children in safe and healthy environments is part of what we traditionally see as the Bill of Rights or our constitutional rights. Fortunately for us, in 1948, the world community, through the United Nations, wrote something called the Universal Declaration of Human Rights. And so, as we started networking with activists from the global south, we learned that they were using the Universal Declaration of Human Rights or the Human Rights Framework to make claims and demands that we were finding ourselves frustrated when we made these claims and demands using the more limited US Constitution. And so we describe reproductive justice as a human rights based framework, which calls into the conversation all 8 categories of human rights to which human beings are entitled. Most of us are familiar with civil rights as the first category because there's a civil rights movement. And there are many civil rights movements, not only the Black-led one that people associate with Dr. Martin Luther King Jr., but the disability rights movement is a civil rights movement. The LGBTQ movement is a civil rights movement. Again, people are demanding simple equality, which is theoretically guaranteed by the 14th Amendment of the Constitution, but it exists more in theory than in practice. And then the second category of human rights that we bring into conversation are called political rights. And these are deeply contested in our society now, leading up to the election, because they consider the right to vote a political right, the right to freedom of speech is a political right, the right to have political associations, the right to have your views represented at the highest reaches of government is part of the political human rights framework. And the third uh, part of the human rights framework is called economic human rights. And we actually have the right to have an economy managed in such a way that it meets the needs of people instead of just meeting the needs of Wall Street. And I think the Occupy movement did an excellent job of defining it's like the 1% against the 99%. And we can bail out Wall Street, but we can't bail out homeowners during the foreclosure crisis. And we can't seem to address the increasing homelessness people are experiencing because of COVID, but we can give $700 billion to the Pentagon. I mean, we're raising serious questions about these violations of our economic human rights. The fourth category, is called social human rights. Social human rights are those rights that you can demand, and they are entitlements based on your human needs. So you can agree that most people have a need for food, shelter, clothing, education, health care, um, and a right to support when they're not able to provide for themselves or have their families provide for them. So that includes welfare, that includes Social Security, unemployment, all the things that are now being retracted by people who are hostile to not only the human rights framework, but hostile to considering that the role of government is to provide social support for people in need. And so that's why we have such contested terrain on the argument of what is America's taxes for? Is it only to build a bigger military or is it supposed to meet people's needs? The fifth category is called cultural human rights. These are the human rights to have your cultural preferences respected. So the right to receive services in the language that you can best access, for example, is a cultural human right. So you might not know that every time you print a flyer or offer services in Spanish to a non-English speaking population, you're actually a human rights defender because you're standing up for people's cultural human rights. And another acute part, an important part of cultural human rights is freedom of religion because you have the right to worship the way you choose or not, and you have the right not to have your religious choices and your religious perspectives dictated to you by another person. But we in the women's movement also argue that people think that freedom of religion somehow contradicts our claim that we also have freedom from religion. We have the human right not to have other people's religious values imposed upon our bodies. And so we would argue that anytime you're imposing someone else's religious strictures and interpretations on other people's bodies who don't share that religion, you're in fact committing a human rights violation because we have the freedom to worship the way we need to worship. And the sixth human right is actually called environmental human rights. This came about after the 1940s and really got more uh, popular in the 1970s as an environmental justice movement came about, quickly recognizing that if you don't have clean air and clean water and food that has not been distorted by genetic modifications and stuff, then you're not going to be around for a long time to fuss about your other human rights. And so environmental human rights are very important. That's the sixth category. The seventh is called developmental human rights. This is a little harder to describe, but back when developmental human rights were first conceptualized, we used to call people in developing countries the third world. And then they were called developing, developing countries, which is where the term developmental human rights comes from. And now we call them the global south. But the reality is that these former colonized countries were demanding the human right to control their own natural resources. So that's what developmental human rights is. Let us develop our natural resources the same way the United States was able to develop its oil reserves and its own industries instead of having these resources expropriated by multinational corporations for the benefit of the global north, while the global south remains in impoverished conditions based on the lack of respect for their developmental human rights. And the eighth category is called sexual human rights, which is my favorite because these are the rights that have been demanded by the women's movement since the early 1970s, particularly with the First World Conference on Women that took place in Mexico City in 1975. And these are the rights that demand we have the right to determine if and when we'll marry, if and when we'll have children, who we want to marry, the right to marry the person we love without restrictions, the right to sexual pleasure, the right to use birth control and abortion or abstinence, as I talked about. And so those were the eight categories that we rested reproductive justice on. But I want to add a ninth category that I think is important to pay attention to because it's emerging within the United Nations systems and it lives in our lives every day. And that is the right to digital human rights because we are now at a point, particularly through COVID, where if you're not digitally connected to the internet, you're going to have your right to access healthcare, education, banking, oh, so many ways that our lives are dependent on electronic communications. If you don't have good access to those things, you're going to have your human rights violated, and you're going to quickly feel like a second class citizen in a first world country. And so I think that after summarizing the categories, you need to realize that human rights is not a finite, closed set of rights, but are constantly expanding because of human demand. Possibly the 10th human right be the right to participate in space exploration. I don't know, but I don't want to. I don't want the rich people to destroy the Earth and then they escape in spaceships to another planet, leaving us behind. So we will continue to demand human rights. So I want to sum up and basically say that once we offered this reproductive justice framework to the intellectual commons in 1994, it just really took off. So that by a decade later, when we had the March for Women's Lives, organized by the Feminist Majority Foundation, now Planned Parenthood, and NARAL Pro-Choice America, this framework had moved from the margins of the women of color movement into mainstream discussion. And then it's gone transnational because it really surprises me when I hear like the Minister of Health of South Africa saying, now we're going to organize maternal and child health and HIV/AIDS services and all these other important public health issues using the reproductive justice framework. And so you never know when that moment of blessed epiphany happens, that you create something that will live long after you're gone. But for me, to have been one of those 12 women that created this transformative concept of reproductive justice, I've been awed by its results ever since we did that. So I'm going to shut up now and let y'all put your questions in the Q&A. But I'll just say one other thing about the transformative power of Black feminist thinking and theory, which is what we created reproductive justice with. We're really at a point to recognize that America needs our votes, but they don't want to hear our voices. And yet we have gifted the world not only reproductive justice, but concepts of identity politics and intersectionality, and we aren't through yet. So thank y'all.
Thank you, Loretta. Thank you so much for your remarks. You are surely a transformative leader in reproductive justice and human rights. So we are so excited to have you here. I am planning to give you a few questions if you're okay with that. And people in the audience, if you can put your questions in the Q&A, I will forward them to Loretta. I have a few to start with. So clearly there have been ongoing attacks against reproductive justice, reproductive rights. And the question is, what policies are critical to maintaining and moving reproductive justice forward from your perspective? And how could advocates work on those?
Well, as a reproductive justice and human rights activist, I think policies follow some other shifts that have to make, cultural shifts. First of all, people have to know that they have human rights that they deserve that need to be protected. And so I say human rights education should be part of every program and policy that's trying to protect people, because people can't fight for rights they don't know they have. And then we need to move human rights into the political process so that we frame the policies that we're asking for and demanding through a human rights entitlement lens. So we stop being out like Oliver, holding our hands out as begging for more. I mean, we really need to be assertive with our demands for our human rights, because that's the way you actually create that culture shift that is necessary. So policies around not only maternal and child health and the different legislative bills that are both at the federal and the state level are necessary, but we also have to talk about how fighting for human rights benefits everyone. Because instead we have policies that get so deeply racialized that you end up with people hostile to the very policies that would help them, like the opposition to the Affordable Care Act, while by people who desperately need health care, who claim that they would rather die than submit to Obamacare. I mean, we have to do a good education of our people for this. I was watching on TV the other day, and there was this woman with a sign that said, I'd rather my family die of COVID than someone make me wear a mask.
Mm.
I mean, that needs to be addressed, and we need to do a deep education through compassion and sympathy and listening. Try to get an understanding of why someone would be willing to sacrifice not only themselves, but their children to such a nihilistic political view. And so we can talk all the policies we want, but until we have standing up for human rights infused in our political process so that we can elect the people who will stand up for human rights rather than violate them, we may not get a lot of purchase on actually getting the policies that we deserve.
Thank you. And what would you, I'm getting a little bit of feedback, sorry. What would you say to the audience? We have over 500 people still online here watching you. What 3 steps would you suggest they take, either in their work or their personal lives, to advance reproductive justice for themselves and their families and their communities? Do you have 3 takeaways?
Well, I don't know if I have 3 because I'm a professional talker, so I might end up with 20.
Okay.
Let me try to narrow it down. First of all, I've been doing a lot of work after writing the 3 books on reproductive justice, or co-writing them, and understanding that how we work together is as important as the work that we do. So my 4th book is called Calling In the Calling Out Culture. And that's the book where I'm writing about us stop being a circular firing squad because we have different political perspectives from each other, and really figure out ways to build bridges across our shared values of kindness and fairness and appreciation for each other, to have these hard conversations that can actually produce change. And this is because we're in a deeply polarized country where people are profiting off the polarization and the hatred. And so how we address that is as important as what we fight for. And so I'm really invested. So that's my first strategy, is to learn about calling people in instead of calling them out so that we can have these difficult dialogues together. My second strategy would probably be to learn about the human rights framework, as I spoke about earlier, because we're running into the weaknesses of our constitutional system, as some people are gleefully exploiting for their own personal power aggrandizement. And so we need to understand that there is a global legal framework that we can call upon and maybe do like South Africa did, and that's produce a new constitution worthy of us instead of inheriting the one originally created by slaveholders that we've been trying to fix ever since.
Right.
And then maybe the 4th thing I would do is to stop keeping our children racially and sexually illiterate. Because as a college professor, I get these 18-year-olds that have not been taught how the world works. And so there's something that's missing in our high school and middle school education if I'm having their first conversations that they've had in life about racial, class, and gender justice. And so I would never want to send my child that ill prepared out into the world. So keeping our children ignorant on how the world works is really a form of child abuse in my mind, because then you expect college professors to stuff it all in their brain in the 2 hours we get every week, when the most important determinant of what a child knows is their parents. And so that would probably be my 3rd strategy. I think we could teach about human rights in K through 12. I've seen it done in a lot of countries, particularly Europe. I think we can teach age-appropriate sex education and racial education, K through 12. I've seen that done in other countries. So instead of just boasting about being the best country in the world, we should act like we really are and take better care of our people.
That's a great message to end on. Thank you so much. We could talk to you all day, but we do have to go to break. Um,